So this is me on the right. It's 1982, and I'm sporting a classic 80s haircut and wearing a hand-knitted sweater made by my mom. On my right is my equally as fashionable sister with the same haircut, also wearing a hand-knitted sweater made by my mom, one that I was later to inherit. My sister Claire is holding my brother Paul. It was his birthday, January 3rd. This is Paul celebrating his 18th birthday. But Paul was born with many complications. And 6 months after this photograph was taken, he passed away. Paul was born with a congenital heart defect called bicuspid aortic valve, whereby your aortic valve develops with 2 rather than 3 leaflets. This is due to failing of separation of one of those leaflets. The aortic valves are very important because the leaflets open and close and allow blood to leave your heart through the aorta to get to the rest of your body. In healthy individuals with 3 leaflets, blood leaves the heart through the aorta, through the aortic valve, and a wide opening created by 3 leaflets. However, if you're born with 2 leaflets and bicuspid aortic valve, that second leaflet doesn't open so well, and so you have a much narrower space, a clinical term known as stenosis. Now, the problem with this is that the same volume of blood has to leave through such a more narrow opening, and therefore your heart has to work twice as hard to push that blood through a much smaller hole. So having bicuspid aortic valve means that you have clinical stenosis. In addition, kids that are born with this congenital malformation develop calcification. And this is a process whereby hard calcified nodules form on the surface of your valve leaflet. Having these hard nodules prevents your leaflet opening, and therefore stenosis is even more increased. So why is bicuspid aortic valve so bad? I've told you you're born with 2 leaflets. In addition to that, there's a narrow opening, and you're more susceptible to calcification. In fact, 50% of children that are born with bicuspid aortic valve develop calcification by the age of 35, whereas you or I, who have 3 leaflets in our aortic valve, may develop age-related calcification by the age of 70. So calcification is much more accelerated in kids with bicuspid aortic valve. Having a narrow opening and calcification causes stenosis. As a result, these kids will develop life-threatening symptoms, including dizziness, fatigue, chest pain, breathlessness, and fainting. And I've told you, your heart has to work twice as hard to get that blood through the narrow opening and a very stiffened valve leaflet. The end result is often heart failure. So 2% of children are born with bicuspid aortic valve, and 33% of the entire population will develop calcific aortic valve at some time in your life. With this in mind, replacement of the aortic valve is the #1 need for surgery in the United States. Last year, 80,000 procedures were performed, costing in excess of $1 billion. So I'm telling you that if you were diagnosed with calcific aortic valve disease today, you go and see your cardiologist, but they couldn't give you a pill, they couldn't give you a shot, they wouldn't tell you to go home and have some chicken soup for your soul. They'd be telling you that surgical valve replacement is the only effective treatment. And without it, you will die within 2 years of having your symptoms of onset without any kind of treatment. So your Prince Charming, who'll be saving you from life-threatening symptoms, won't be coming to see you on a unicorn. He'll be coming to see you wearing a surgical mask, a surgical hat, and wearing a scalpel. But you have your surgery, the surgeon works his magic, and 2 or 3 days later, you leave the hospital sporting your new aortic valve. Everything's good, right? Short term, yes. Long term, not so much. If you receive a biological prosthetic valve, you'll be on anticoagulant therapy for the rest of your life. In addition, that biological valve is more susceptible to calcification than the valve you were born with. In addition, kids that receive mechanical valves, the valve fails to grow with the patient. And as a result, in both cases, you will require extra surgery or extra therapeutic intervention throughout the rest of your life. So with me telling you that 33 out of 100 people sitting in this room right now will develop calcific aortic valve disease. And this number will grow as we all live longer. It's 2016, and I'm telling you that the only outcome of effective treatment is surgical intervention. I say we've got a major problem on our hands. So for me to tell you why this is such a problem, I need to tell you all I know about heart valve biology, but this won't take long. Highlighted right here is the aortic valve flapping. This is the reverse of the heart, showing the tricuspid valve, and you can see opening and closing of those valve movement as the blood would go through the heart. Here's the top of the heart. We're looking down, and highlighted here is the aortic valve that in some kids, 2% of kids, is developed with 2 instead of 3 leaflets. So what are valves made of? Valves are made of cells, and the cells are held together by glue that we call extracellular matrix. Think of it like cookie dough. The dough is the extracellular matrix, and the cells are the chocolate chips within that cookie dough. In a healthy valve, the cookie dough is made of 3 layers, and each layer offers the valve a unique biomechanical property to allow it to open and close during the cardiac cycle. Shown in gray here is cookie dough that's made of elastin, allows the valve to stretch. In blue, the cookie dough is proteoglycans that absorbs the force that's created by the blood flow as it leaves from the heart through the aorta. And finally, in yellow, the cookie dough is made of collagen, and this gives tensile strength to the overall valve. At my lab here at Nationwide Children's Hospital, we've shown that healthy valves are made of cartilage. Their cookie dough is like cartilage, like the one in your knee. It allows the valve movement to open and close with each cardiac cycle. It's very compressive and very pliable. In contrast, my lab has shown that in calcific aortic valve disease, the cookie dough is no longer pliable, but instead the extracellular matrix is like bone, and more like a burnt cookie. So moving forward and thinking about therapeutics beyond the surgeon's knife, we need to find a way that we can promote this healthy cartilage-like material in the valve and prevent the bone from forming. My lab works on a gene called SOX9. And in your skeletal system, SOX9 is required to develop and maintain cartilage in your leg. This is important. You want your cartilage to stay cartilage and not turn to bone. Otherwise, you'd be walking around like Tin Man. In heart valves, SOX9 does the same thing. When SOX9 is there, you're promoting the cartilage and maintaining a healthy valve leaflet. At the same time, you're preventing the bone from happening and preventing calcific aortic valve disease. In fact, if we take away SOX9, the reverse happens, and we lose that healthy cartilage, and we gain the bone, similar to human disease. So it's taken me 14 years to get to this point to stand up here and tell you that we have identified a gene that we can manipulate. If you have high levels of SOX9 in your valves, you will be healthy, and you will have a cartilaginous valve that opens and closes during the cardiac cycle. If you have low levels of SOX9, we think that in humans you will develop calcific aortic valve disease. So moving from here, 14 years to get to this point, it could be 20, 30, 40, 50 years from here until we could use this in the clinic. But our goal is to identify those patients that have calcific aortic valve disease, those patients that have bicuspid aortic valve and are highly susceptible to developing calcification, and use this sliding slope to give them back SOX9, to rescue them from that bone side and take them to the cartilage side. We can do this by gene therapy, or maybe by tissue engineering approaches, by giving SOX9 cells back to the patient. My inspiration for this story comes from making new scientific discoveries every day. I see things down a microscope that nobody else in this room will ever see. My inspiration also comes from growing up with my brother Paul, who was taken away far too early for me to tell him about this discovery. So in closing, I ask you to think about how you and your family have struggled with cardiovascular disease. And I'm here to tell you that there is light at the end of the tunnel, and moving forward, how we'd like to see SOX9-based therapy as our new superhero in the treatment of calcific aortic valve disease. Thank you.